there. Today we're going to be talking about the drug cannabis. So, cannabis, also known as marijuana, pot, weed, is a very commonly used drug in Canada. We are going to talk a little bit about the classification, how the drug is used, the effects of cannabis, how mental health conditions may be impacted by the use, and what harm reduction looks like with this drug. So, it is a psychoactive, which means mind-altering drug, and it's produced by the cannabis sativa plant. When we're looking at the effects of cannabis, this may feel like a general sense of relaxation, a feeling of well-being, and then there is an accompaniment of mild hallucinogenic effects. So this may be a distortion in the sense of time, vivid visual and auditory perception changes, and then some other effects may be things like problems with memory and learning, difficulty in thinking and problem solving, as well as a loss of coordination. Marijuana is usually smoked, so using a joint, a pipe, a bong, but it can also be mixed with food or it can be brewed as a tea. And when marijuana is smoked, the THC, which is sort of the psychoactive component of the drug, passes from the lungs and into the bloodstream. This carries the chemical to the organs in the body, including the brain. Now we're going to be talking a little bit about dependence. So when we talk about dependence, this is essentially when more casual, recreational, infrequent use becomes more habitual. And we're looking at things like withdrawal symptoms, tolerance, and functional consequences as well. So some withdrawal symptoms may include irritability, mood and sleep difficulties, decreased appetite, restlessness, and other various forms of physical discomfort. And then when we're looking at tolerance, so essentially the brain is adapting to larger amounts of the drug and the individual is needing higher amounts of the drug to feel similar effects. And then lastly, we're looking at some functional consequences. So this may feel like or look like a persistent desire or unsuccessful attempts to reduce substance use, impairment in social, occupational, and recreational activities, things like greater amounts of time spent obtaining the substance or continued use despite recurrent problems. And likelihood of developing problematic use depends on different factors. So things like length and intensity of consumption, potency of the product, so how much THC is in it, and then there are individual factors, so things like genetic or individual vulnerabilities, personality, experiences of trauma, and the last thing would be age of initiation. So when did an individual begin using cannabis? So now we'll just talk a little bit about mental health conditions that might impact the effects of the drug. So there has been evidence that has shown that cannabis can exacerbate symptoms of depression, also can impair cognitive functioning, and can induce psychosis. Additionally, can trigger schizophrenia in people who are predisposed and worsen symptom control in people with schizophrenia. Adolescents and people with primary psychiatric disorders appear to be particularly vulnerable to the effects of cannabis. So this is a really important thing to consider. And finally, we're just going to talk a little bit about harm reduction. So harm reduction is essentially the acknowledgement that for some people, stopping substance use or the use of a substance or cutting back may not be realistic or may not be the goal for some individuals. It is also the acknowledgement that using a substance may cause harms to an individual, and how can those harms be reduced, or how can those harms be minimized to better support an individual regardless of using the substance. So with cannabis, harm reduction might look like instead of smoking, which may have some physical implications or harms, using things like cannabis oils or edibles. Another tool or another step may be choosing low potency products, so lower in THC, higher in CBD. And then also something like avoiding using other substances while using cannabis, so not drinking alcohol, for example. Another thing to consider may be not driving while under the influence of cannabis. So these are all things that may improve the quality of life for somebody and reduce or minimize the harm caused by cannabis use. So yes, that's a bit of information on cannabis, and thank you so much for your time.